I'm Dr. Craig Joseph.
And I'm Dr. Jerome Pagani. And this is Doc Talk. What's better than having a patient an arm's length away? A whole bunch of patients just a click away. The integration of digital tools for interacting with, assessing, and treating patients outside of a traditional healthcare setting accelerated during the COVID-19 pandemic and is now reaching the point of stickiness. We see this across the global landscape with initiatives in the EU and China, as well as with groups like the World Health Organization, which published a global strategy for digital health. That's a long way of saying digital health technologies are becoming a core part of healthcare.
Well, the third quarter of 2022 was the slowest quarter for digital health funding in the last 2.5 years. Digital health investments were still a robust $12.6 billion in 2022. Solutions for non-clinical workflows were the top funded value prop, while mental health remained the top funded clinical indication in digital health. Adoption of digital tools also remains high. The readout from an annual AMA study was that the average number of digital health tools in use by a physician grew from 2.2 in 2016 to 3.8 in 2022. They also reported that the percentage of physicians performing telehealth visits topped 80% in 2022, up from just 14% in 2016. The percentage using remote monitoring devices with their patients also grew from 12% in 2016 to 30% in 2022.
Digital health holds the promise of better access to clinical care, engagement, and representation. For instance, women, minorities, and older people have long been underrepresented in clinical trials. These studies are increasingly using digital tools that could, in theory, help with access and representation. There's a risk, however, that unequal access, familiarity, or comfort with technology will continue to create a divide. A one-size-fits-all approach to digital health applications threatens to widen the chasm of health inequalities rather than bridging that divide.
Most digital health technology interventions show efficacy in populations who are relatively healthy or who have a high socioeconomic status. More specifically, there may be an assumption of a better ROI because those studied have better access to care and the resources to follow through on health services, buy medication, support a preventive lifestyle, and more. Designs that primarily engage these populations can increase unequal outcomes by becoming a digital determinant of health.
Without proper planning, design, and safeguards, digital health technologies can contribute to health inequities, widening the existing digital divide that separates those who can access or receive digital health interventions from those who cannot, for reasons that include a lack of digital infrastructure for broadband access, financial barriers that limit access to devices or data, and low digital health literacy, a factor that's higher in disadvantaged communities. A strategy for reshaping care delivery around digital capabilities must consider the people who will be giving and receiving care, including the recipient's social determinants of health. This highlights the importance of using human-centered design principles in healthcare, a topic we'll be discussing quite a bit this year.